This is Leslie Villery, Assistant Director of Special Education Programming and Instruction with Cy-Fair ISD. This is a training on Child Find. What is Child Find? It is a component of IDEA-B that requires the LEA or the local education agency, in this case, Cy-Fair ISD, to identify, locate, and evaluate children with disabilities. Three things that I want you to get out of this slide: identify, locate, and evaluate. Most important part of this. Who is that? Our responsibilities are for any child from birth to 21, birth through 21, regardless of their advancement from grade to grade. What? There are 13 eligibilities. I'm going to list them out for you. It's autism, deaf and hard of hearing, used to be auditorily impaired, deaf blind, ED or emotionally disturbed, intellectually disabled, multiply disabled, non-categorical early childhood, orthopedically impaired, other health impaired, specific learning disability, speech impaired, traumatic brain injury, and visually impaired. Who does this include? Any child, again, from birth to 21, regardless of enrollment, which is public, virtual, private, or homeschool within our district. Any of those we are required to do Child Find on, regardless if they're homeless or high mobility, regardless if they are in foster care, regardless if they have a military connection, or if they're involved in the criminal justice system. And the last one, regardless if they're in a care facility like a state school, a group home, or a nursing home. Child Find is from 0 to 21, and FAPE, which is free and appropriate public education, is 3 through 21. So birth to 21 for Child Find includes those children that are born with a visual or auditory impairment. Those students are served through our ECI program in our region or district area from 0 to 3. And then from 3 to 21, the public school provides that. Our legal responsibilities start with public awareness. We provide public awareness through distribution of flyers and posters within the district buildings, daycares, doctor's offices, and places of worship. Probably our biggest flyer or public awareness goes to individual doctor's offices throughout the Cy-Fair area. Our legal requirements on our written explanation includes an option and requirements for assisting students who have learning difficulties or may need a special education. That a parent or guardian may request an evaluation for special education at any time, and who it is that they would contact for an initial referral. Second part of our responsibility is birth to 3. A referral, if a child is suspected of having a disability during that time, the child must be referred to local early childhood intervention or ECI for an evaluation within 7 days of the request. The district would coordinate an evaluation and services between the local ECI and the district. If the child is within 45 days of turning 3, the child would be referred to the district for the evaluation. Continuing our legal responsibilities, from age 3 to 5, the district is responsible for the referral process as well. Referrals for this age group follow the same procedures and guidelines as those age 5 and older. Students who qualify for special education would receive free of cost through the district. One example is our ECSC program, or what used to be called PPCD. Private schools are also our responsibility. If a parent of a private school student requests evaluation from the district they reside in, but the private school is within the boundaries of Cy-Fair ISD or any LEA, the two LEAs should collaborate in working with the parent, as these students often return to their district of residence. I wanted you to know we have board policy on the identification, including child find, private schools, and preschool students. We have board policy on referrals and requests for evaluations, including our initial evaluation, our time frame of completion, psychological evaluations. We also have board policy on the eligibility and reevaluations, which would be our disability definitions, visual and auditory impairments from birth on, determination of eligibility, consent, and independent evaluations. Our last one is prescription medication. District employees here are prohibited from requiring a child to obtain a prescription as a condition of attending school, having an evaluation, or receiving special education or related services. We are not prohibited from consulting or sharing classroom observation with parents regarding the student's academic and functional performance, behavior, or the need for evaluation for special education or related services. Our procedures, our pre-referral, our interventions and strategies are key in helping children close the gap and make progress through their grade level curriculum, but they do not necessarily serve as a precursor for the evaluation. It is important to know that you do not wait to refer if you suspect a disability and need specialized services. The key to that is the specialized services. It does not mean that you do not go through the RTI process. That is intended for early intervention to close those gaps. If progress is not made, the evaluation should be considered, but you should not prolong that to not get a consent to evaluate. Our procedures for the referral process, or SIT, who can make a referral? Again, any parent, legal guardian, school personnel, another person who is involved in the student's care or education. The student data review, while reviewing the student's data, the campus should seek an answer to important questions. Is there a reason to suspect that the student has a disability? Is there a reason to suspect that because of the disability, the student needs special education and related services? Based on the results of the data review, a prior written notice will be sent to the parent proposing or refusing an evaluation for special education and related services. When a verbal or written request for evaluation is received, a prior written notice of proposal or refusal to conduct an evaluation must be sent to the parent within 5 school days. The most important part I want you to get out of this is verbal or written. So if a parent were to ask you for an evaluation, you need to make sure that you go with the process as though they would have asked in writing. Informed consent is really important. Prior to an evaluation, the district has to make a reasonable effort to gain the parent or legal guardian's informed consent. And that's just what it sounds like, informed. They understand what they're agreeing to. If the parent does not provide consent or fails to respond, the district can go through due process procedures to pursue an initial evaluation. If a parent does not want to provide consent, it is a good idea to discuss the parent's reasons why and to revisit the referral each semester. Sometimes a parent may mistake consent for evaluation as agreeing to provide the child with special education or related services. Consent does not equal placement. It is important for parents to know the evaluation is for identification purposes. If their student is identified as having a disability with an educational need for services, they will still have the opportunity to accept or deny the proposed services. Time frame. Our diagnosticians have 40 school days to complete the evaluation. 40 school days. Eligibility. We still have 13 IDEA disability categories, and a student must qualify for at least one of those. I'm going to read those one more time. Autism, deaf blindness, deaf or hard of hearing, emotional disturbance, intellectual disability, multiple disabilities, non-categorical early childhood, orthopedic impairment, other health impairment, speech impairment, specific learning disability, traumatic brain injury, and visual impairment. Sometimes a student may have an outside medical diagnosis, but not an educational need for those services. It's very common. Because they are getting services outside of the school in a medical setting does not necessarily mean they need it for an educational setting, for an educational need. Time frame. The ARC committee has 30 calendar days from the completion of the report or the FIE to make decisions regarding initial eligibility and, if appropriate, IEP and placement. If the 30th day occurs after the last instructional day, the campus has until the first day of fall classes to finalize decisions. Okay, let's take a quick quiz, just 5 questions, see how we did. Blank mandates the child find responsibility for all public and charter schools in every state. Who mandates that? Answer D, the Individuals with Disabilities Act, or IDEA. Child find is a process of locating, identifying, and blank all children with disabilities from birth through 21 who may require early intervention or special education services. Hopefully everyone got this one right. It would be evaluating, locating, identifying, and evaluating. Which eligibility category do we not utilize in Texas? The answer to this one, letter C, developmental delay. That used to be an eligibility, but no, it no longer is. Who can make special education referral for an initial evaluation? There could be more than one answer. Okay, school personnel, yes. Parent or guardian, yes. Physician, yes. Daycare provider, yes. Student peer, no. Last question, true or false? Pre-referral interventions and strategies may be attempted prior to an evaluation. However, the LEA could be in violation of its child find duty by repeatedly referring a student for interventions rather than evaluating the student need for special education and related services. That is true. This concludes child find training.